It is common knowledge that exercise is very, very good physiologically for all systems in the body. However, the cardiovascular system especially benefits with regular exercise. Aerobic exercise, which uses oxygen, increases cardiac output and also increases metabolic rate. Since exercise uses lots of energy, it's also going to affect our triglyceride levels and help in controlling weight. Exercise shows lots of benefits towards anxiety as well as depression and helps to overall decrease blood pressure. And for all of these reasons, that's why eating right and exercising are two of the most commonly prescribed life changes to combat many conditions. A cardiac transplant refers to the replacement of a damaged heart with that of the heart of a healthy donor. Cardiac transplants are usually used for patients that are undergoing end-stage heart failure. In order for somebody to be considered an appropriate donor, they have to pass tests such as a blood test and tissue typing tests. Patients undergoing a transplant must always remain on immunosuppressant drugs to prevent rejection of the organ that has now been transplanted. You have to keep in mind, we are transplanting a foreign tissue into the body, so we have to make sure we suppress the immune system to prevent any adverse reactions to that new organ. You will find more about transplantation in your book on page 724 and 725. A few other procedures that can greatly assist the cardiovascular system when it is damaged or overall considered in an unhealthy state will be discussed next. The intra-aortic balloon pump is a very fascinating procedure we see used to increase cardiac efficiency. Two benefits we see with this procedure are improved coronary blood flow as well as increasing the ability of ejection from the left ventricle. Essentially, this little balloon is inserted into the femoral artery and passed up into the thoracic aorta. When the ventricles begin to relax, the balloon is inflated, and that pushes blood both backwards towards the heart and also forwards towards the peripheral tissues as well. Ventricular assist devices are just as they sound. They're going to help weakened ventricles pump blood. And this takes some of the work off of the ventricles. These will often be used to help patients survive long enough so that they can get a transplant. These can be used in both the left ventricle and in the right ventricle, however, they're much more common in the left ventricle. The next condition we'll discuss is coronary artery disease. Cardiovascular disease, diseases relating to the cardiovascular system, is the leading cause of death worldwide. And arteriosclerosis is one of the contributing factors to this. Arteriosclerosis refers to a group of conditions that refer to a loss of elasticity and the thickening of the walls of arteries. One of the most common forms of arteriosclerosis is referred to as atherosclerosis. Atherosclerosis is characterized by large plaques forming in the walls of our vessels. When large plaques deposit in the walls of our arteries, that's going to prevent flow. You can really see on this picture how obstructed this vessel is with this atherosclerotic plaque sitting right here. Atherosclerosis is definitely a term that you should be familiar with. One procedure that can be done to mitigate the effects of atherosclerotic plaques is what's referred to as a coronary angioplasty. As shown on the right, you can see in this procedure, we take a catheter that's attached to a balloon and insert it into the vessel. The balloon is inflated and that pushes the atherosclerotic plaque out of the way, and therefore that's going to increase the lumen of the vessel. One other procedure that can be used to help manage damaged or overblocked vessels is referred to as bypass grafting. Grafting is a procedure where a blood vessel from one part of the body is taken and put somewhere else within the body. So coronary artery bypass grafting takes blood vessels from somewhere else and attaches them so that it will take the place and function as if it were a new coronary artery. Stents are fine wire meshes that are inserted into vessels to keep them open. This allows for continued and more efficient blood flow. Congestive heart failure is a homeostatic imbalance of the cardiovascular system, where the heart loses its pumping efficiency. With less efficiency comes less cardiac output. We need our cardiac output to meet certain parameters. And with congestive heart failure, we're not pumping enough blood to meet the needs of the tissues. This can be caused by atherosclerosis, hypertension, or myocardial infarctions, which can also be referred to as heart attacks. Oftentimes, with congestive heart failure, one side of the heart begins to fail before the other. If the left ventricle fails first, it can't pump all of the blood that it is receiving, and this ends up backing blood up in the lungs and leading to pulmonary edema. On the flip side, if the right side of the heart fails first, we'll end up with systemic edema. One of the more types of common heart defects are congenital heart defects. These are heart defects that are present at birth, and many of these are not seriously life-threatening. However, others can be much more severe. Septal defects are one of the more common defects that we see. Septal defects refer to openings in the interventricular septum, and this allows for the intermingling of oxygen-poor blood with oxygen-rich blood. Patent ductus arteriosus is a similar condition where there is a mingling of oxygen-poor and oxygen-rich blood. However, this is going to refer to a connection between the aorta and the pulmonary trunk. During fetal development, there naturally is a connection between these two major vessels, referred to as the ductus arteriosus. This helps for a more efficient blood circulation when the fetus is developing. Naturally, this connection closes shortly after birth, so if it doesn't close, that's our patent ductus arteriosus. Coarctation of the aorta refers to a narrowing of this major vessel entering into the systemic circulation. This slows oxygenated blood flow to the body, and the heart compensates for this by causing the left ventricle to work much harder. This often results with high blood pressure and will need to be treated surgically. Tetralogy of Fallot is another congenital condition that we'll see. However, this condition is a combination of 4 developmental defects. The first of which is a defect in the interventricular septum. As just discussed, this leads to the intermingling of bad blood with good blood inside of the heart. And this also results in our second defect, which is an aorta that is emerging from both the right and the left ventricles in this instance. We end up with valvular stenosis in the pulmonary valve and a hypertrophied right ventricle. Due to the valvular stenosis of the pulmonary valve, decreased blood flow makes its way to the lungs. And because of the septal defect, that deoxygenated blood isn't having as much of an opportunity to go get reoxygenated, and it gets mixed back into the systemic circulation. Fortunately, this can be surgically treated. So to stick with our theme in anatomy and physiology, the heart is also, just as everything else, going to be affected as it gets older. The stiffening and thickening of the walls of the cardiovascular systems is an inevitable reality as we get older. We don't respond to stress as well, as the sympathetic nervous system will not be working at its greatest efficiency either. In the case of myocardial infarctions, cardiac muscle cells may die, and this will replace those cardiac muscle cells with fibrous connective tissue. Naturally, this leads to a less efficient heart. And as discussed in great detail by now, atherosclerosis is referring to the deposits of different plaques on the walls of our arteries. This narrows the lumen of our blood vessels, prevents blood flow, increases resistance, and therefore, in turn, will increase blood pressure. And lastly, to finish up, a couple clinical terms that you will likely see in your future careers as you go on to be doctors, nurses, and PAs. Asystole, as it sounds, is an inability for the heart to contract. The prefix a tacked on to systole, meaning contraction, is a failure for contraction of one of the chambers of the heart. Heart palpitations is another condition that we will see. Heart palpitations refer to very increased irregular heartbeats. These can often be caused by drugs and other stressors. Stimulants such as Adderall and Ritalin often cause heart palpitations, but these can also be caused by milder agents such as caffeine. Lastly, hypertrophic cardiomyopathy is a condition that often occurs in athletes. The enlargement of cardiac muscle cells causes the walls of the heart to increase in size. The thicker the walls of the heart, the greater the contraction strength will be. If the walls of the heart get too big, this can actually hinder the filling of blood in the ventricles. Essentially, there's no space left for blood, and if bad enough, this can lead to death. Now you'll see after this are some slides here with a couple practice questions for you all. Feel free to answer these on your own time. And after this, you'll also see some EKG tracings. This one shows a normal EKG reading with our P wave, our QRS complex, and the T wave. This is what an EKG tracing is supposed to look like. The remaining EKG tracings are going to indicate certain heart conditions and how we can read them with the EKG. This is a first-degree atrioventricular block, and you can see that that's shown by an increase in what's known as the PR interval. Essentially, this P wave is much further away from the QRS complex than it should be, and that indicates a first-degree atrioventricular block. Atrial fibrillation is another condition that can be diagnosed with an EKG. There's no P waves that are able to be seen, so that tells us that there's not proper voltage passing through the atria. And lastly, ventricular tachycardia and ventricular fibrillation are two other conditions that can be diagnosed here from the EKG. At this point, we don't even really see a nice EKG tracing anymore. So feel free to take a look at each of these tracings to get an idea of how we can use that clinically to understand the efficiency of the heart. That will conclude Chapter 20. We will pick up in the next lecture video with Chapter 21 when we will discuss the blood vessels.